Hello and welcome to our Facebook Live today, where we're going to share some current coronavirus trends in Union County and answer some of the most common questions that we have received recently. My name is Dennis Joyner and I'm the Union County Public Health Director.
I'm Ashley Burts and I'm the Communicable Disease Lead Nurse.
Over the past several weeks, Union County has seen a pretty rapid increase in the number of cases of COVID-19. Just June 24th, actually, there were just over 1,000 cases. We were at 1032. Our most recent numbers, as of just a little bit ago, we're at 2,030 cases. So we've had actually over a 94% increase really in about 3 weeks. So the rapid increase in the number of cases is obviously a concern. North Carolina is seeing some rapid increase as well, but it's something that we want to continue to be diligent with. I know that everyone is concerned and quite frankly, many people are tired. I think we're all tired of COVID-19, but it's going to be with us a while, and so we're going to have to be diligent in using the preventive measures we can to address this trend. We've had 30 deaths in our county attributed or related to COVID-19 infection, and we have also seen some trends over the last number of weeks where the average age of the cases has decreased some. We're seeing more in the 20s age group and younger across our county. And some of that also is reflected as well across North Carolina. Over the last 7 days, we've been averaging about 60 cases a day. And that is a huge increase from just a number of weeks ago when we were averaging 15 to 16 cases a day was probably very, very common. So we have seen very rapid increase over recent days, and certainly that is a point of concern that we want to stress to folks in the audience.
We'll take some questions now. One that we get that's common is, can you briefly describe what happens after public health receives notice of a resident with a positive COVID-19 test?
Yes, the first thing that we want to try to do is to make contact with that person to make sure that they're okay, to make sure that they're still able to be at home, and to find out what symptoms they had, when those symptoms started, and then who they've been with before they got sick, and since they got their test result, to find out what contacts they may have had.
Who should be tested for COVID-19 and when? And there's a second component. What should you do after being tested but before you get the results?
Anybody who is symptomatic should be tested. If you're a close contact of somebody who's symptomatic, that means you live in the same household, or you sit at a desk right beside them, or you've had social contact with them that's been more than 15 minutes within 6 feet without a mask, you should be tested. If you work in a place where there are multiple people that have been tested positive, you should go get tested. If you think you have any risk, you should go and get tested. While you're waiting for your results, your isolation period should start then. Immediately when you leave the testing center, you should go home, isolate yourself, even from your family as much as you can, so that you won't be then spreading any infection to people unknowingly, before you get your test results.
If you don't mind repeating the question you just answered, somebody commented that they had a hard time hearing it, which was who should be tested and when and what they should do while they're waiting their results.
Right. Anybody who has symptoms, if you have a fever, cough, shortness of breath, if you've lost your sense of taste or smell, if you are having a bad headache that you don't usually have, any symptoms that may be related to COVID, you need to be tested. If you're a close contact of someone, you need to be tested. If you live with somebody who's been sick or someone who had a positive test or work with somebody or just any kind of close contact, you should be tested.
So, excuse me, so we've had a question about contact tracing. And so I'm going to ask you the question, but then I need you to repeat the question that I asked so that
Gotcha.
they can't hear us very well. So with contact tracing, how are most people contracting the virus? Stores, restaurants, family events?
Well, I'll start. The question was, how are most people contracting the virus, the trends that we're seeing in the county? Most are more recently contracting it through contacts to positive cases or just general community spread that they're seeing in the community. More increasingly, we're seeing percentages of increase with contacts to positive cases, and that's someone that they knew was positive, or they found out that they were positive, that they had some exposure to. And Ashley may want to expand on that.
Mm-hmm. That's part of the reason for once a person tests, they should isolate. That time that they're waiting to get their results, they can be shedding virus. So the people that they have been in contact with then a few days later find out, oh, I was with that person during this time, I need to be tested too.
Yeah, roughly 40% of the cases that we have currently, their primary method of spread is through contact with a positive case.
How does a mask or face covering help slow the spread of COVID-19?
The question was, how does a mask or face covering slow the spread of coronavirus? And one of the things that's really, really important, I know there's a lot in the news about the use of masks or face coverings. It really is one of our best preventive measures that we have available right now to help curtail and slow the spread of the virus. The virus is spread through water droplets, and when we cough and breathe and just talk or sing, or whatever that we're doing vocally, we're sending out virus on water droplets. And the more that is done without any kind of blockage, the greater the risk of the transmission. And so the mask or face covering is an important and critical step for us to try to put that barrier there to slow that transmission to other people. To make the point, the mask is really for protecting others from you, because some folks can be asymptomatic and not know they're spreading the virus, and so it's a way for them to protect others in their family and in their community. And so it's a critical point in helping protect our community.
We have a question about, do the number of cases that we report include second tests of the same person or antibody tests? So if you can include the question in here.
Right. Do the number of cases that we report include a second testing or an antibody test? No, they don't. Many people, for reasons to return to work, have to have a negative test. And so they may go and have another test that is positive, just like the first one was. Those tests are all grouped into the same event that person has, and so it's only counted as one positive. Even if they tested 20 times in that time frame, it would still just be one positive that we would count. As far as the antibody testing, right now those are not confirmed cases, and we have not seen any antibody results in Union County residents. When we do get those, then we'll, report them as they are.
If you get COVID-19 once, can you catch it a second time?
That's a question that a lot of folks have a common interest in. Obviously, the question was, can you get COVID-19 infection a second time if you've already had it? The long story short to that is it's still too early to truly know whether or not that is a possibility. There have been some animal studies and some of the research has shown that that there is some resistance after someone develops COVID-19 infection. They develop antibodies to fight off the virus and the illness during that time. The problem is we're still learning about how long folks will have that resistance or that immunity from being having the exposure the first time. And so really it's still it's a question that's being looked at, but there's not confirmation. There's been some information out in the media and the press where there have been reports of folks who've said they maybe had gotten it a second time. They've also seen that in some cases someone may test positive a second time. That may have been some residual elements of genetic material from that first positive that was getting picked up in the test. So the jury is still out on that question.
Thank you. There's a number of questions about children. So can you speak to kids' safety and transmission of COVID-19 and transmission among children?
Right, and well, can we speak to the transmission of the virus in children and the safety of children? That seems like that's a whole different scenario. Children, for the most part, seem to be faring very well. The transmission that would occur the very same way as it does in adults, through speaking and laughing and droplets and playing outside together. Having children wear masks, of course, is something that's a little bit more challenging than in the adult population. We expect that we'll see more children becoming infected as we have more gatherings where kids are together, daycares and in schools, and we will, just continue to try to address those and provide education for the people that are going to be caring for them.
Along with wearing a face mask, what can people be doing to help slow the spread of COVID-19 in Union County?
So the question was, what can folks do to help slow the spread in addition to wearing face coverings? I think one of the big things is we need to be really, really conscious of our surroundings and to the extent we can stay out of crowds and close proximity of folks. We realize that this is a highly transmissible virus, and the closer you are without a barrier, the greater the chance of the transmission occurring. So I think if we can not drop our guard as it relates to wearing our face coverings and masks when we're out in crowds or when we can't effectively socially distance, we need to also be careful that we stay apart, we stay away from each other and folks that we in crowds where we would be in large groups for any extended period of time. That's a critical measure as well. And I think just modeling that behavior is an important thing, because it's important for us to sort of normalize that in our community over time, because this is not going to go away anytime really, really soon. I mean, we all wish that it would, but it's pretty prevalent in the community right now, and we're going to be dealing with this for some time.
Are face shields okay without a mask?
The mask is to protect people that are face shields okay without a mask is the question, sorry. The mask that I wear is to protect people that I'm with, so that as I talk to them, it protects them. A face shield would give some protection to the other person, but it's going to protect my eyes and my face more from them. So the best thing to do is to wear a mask. If you want to wear a face shield as well, you can, but the mask is the most important thing. Face shields probably should be reserved for healthcare personnel and people that are going to have close contact, because they're more at risk, and it would do more good for them to have that than the general public wearing a mask.
This will be our last question. From a public health perspective, what are your concerns with the current trends we are seeing in Union County related to COVID-19?
The question was, what are our greatest concerns from a public health perspective looking at the current trends in COVID-19 in the county? And I would say that the biggest concern that I have is the rapid increase that we've seen in the numbers. It is concerning because it does demonstrate the level of the high level of virus that there is in the community. And so we really want to see that level off. That's really, really important. We've been very, very fortunate to have a tolerable impact in the healthcare and the hospital community in terms of folks that have to be in the hospital, but that can change very, very quickly the higher the volume is of cases that are there. So we're seeing high numbers of positivity in terms of the cases that we have. We currently are at about 10% of the tests are coming back positive over the most recent full week. That's compared to the state, which is about 9%. So we're a little bit higher than the state. We want to see that positivity percentage go down and go consistently down over time. So that's the biggest concern for us in terms of what the trends are. Well, that will conclude our segment for today. I want to thank you for joining us, and if we didn't answer the questions, feel free to send a direct message, and we'll try to respond back to that. So I want to thank you all, and I want everyone to remember the 3 W's. Wear, wash, and wait. Thank you.
Thanks.